Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUM News Extra. A kidney stone is a hard mass developed from crystals that separate from the urine within the urinary tract. For most people, chemicals in the urine help prevent or inhibit the crystals from forming, but for others, stones will form. Some crystals will be tiny enough that they'll simply pass out of the body unnoticed, but others can cause serious pain in your stomach, on your side, or even in your groin area. Kidney stones are often the cause of blood in the urine. Here to tell us more about these stones and how to prevent them and get rid of them is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in as always. Now, what are kidney stones? I talked a little bit about it in the intro, but for those people at home who've never experienced the pain of kidney stone, what is it?
Well, I hope they never do. But kidney stones, as you mentioned, are crystalline formations. Normally, we have minerals in our blood that get filtered through our kidneys and then we urinate them out. But sometimes those minerals will come out of solution and form just a little tiny crystal accumulation, and then more crystals can add on to that, more mineral adds on to that, and pretty soon you have a small stone, which can even grow into a larger stone. And there are sort of 4 different types of kidney stones. They have to do with calcium, with oxalate, which is found in tea and coffee, for example, uric acid, that's the one that goes along with gout, and then we have something called struvite, and that goes along with infections in your urine, and it's produced by bacteria. So all these different minerals and chemicals can come together, particularly if you're not hydrating very well, and they won't flush out. They'll accumulate little salty looking crystals and cause you lots of trouble down the road.
Okay, so you said hydration. Now, is that part of the reason how you get them, or is it hereditary, or maybe both for some people?
Yeah, a combination. So you have hereditary factors, definitely it does run in families, and certain health conditions will produce more calcium or more uric acid. For example, like I mentioned, people with gout or certain people with thyroid conditions, for example, might produce more calcium in their bloodstream. So then, or people that just eat too much calcium, you know, and so then you have that factor, that's how much mineral you have, and then you have the factor of how well are you flushing. So if you're not hydrating well enough, or if your kidney maybe already has a different disease, it's already an injured kidney from maybe high blood pressure or diabetes or some other health condition, then your kidney isn't flushing as well, and those stones will accumulate.
Now, what are the symptoms and the pain associated with this? Because I hear it's very painful.
It is. It's comparable to having a baby. That is how painful kidney stones can be when they're passing. Yeah. Sometimes the stones can be silent, meaning they're at the periphery, at the outside edge of the kidney. They're just sitting there. They're not causing any trouble, but they are silently growing. And then sometimes they'll get dislodged and they'll just start to move down into the ureter. The ureter is the tube between the kidney and the bladder. The tube that takes your urine from the kidney down into the bladder. And as they pass into the ureter, that's when the pain begins, because that ureter is a very thin little tube, and then you've got a hard little rock with sharp edges trying to move its way down, and it scratches and it hurts, and that's where you get the blood. As it's scratching its way down through that ureter, it's causing bleeding. And so the pain is very severe. It can be basically what we call a colicky pain, meaning it comes and goes, extremely painful, traveling down into the groin area or up to the back, people just writhing in agony. So something you really want to avoid.
Now, and that's the next thing, is how do people avoid it? And you talked a little bit about hydrating, really flushing your system out, so to speak. So how can you prevent getting kidney stones?
Right. Well, the best way to prevent kidney stones is to flush yourself and hydrate really well with water. So when you go to the restroom, your urine should be a clear color, not a yellow color. That's how you know. Thirst is really not a helpful indicator. Sometimes we don't feel thirsty, but we actually are dehydrated. So making sure that you're doing that. Then avoiding coffee, tea, soda in excess, because those make the chemicals accumulate. And then once a year or so, get a checkup and get your urine checked along with your annual health exam, just to make sure that your urine is healthy. And these chemicals can be picked up on a regular urine test, and sometimes even in the blood. And we can tell you, oh boy, you are prone to kidney stones. Please be careful, or sometimes even take medicine to prevent them from forming. There are medications you can take to prevent it.
Now, are men more prone to getting kidney stones than women? Because I have heard you mention that it's related or equated to giving birth, and we both know how that is, and that's very painful.
Very painful.
But for men, you know, they don't obviously have ever gone through labor, but I hear it's kind of the equivalent for men.
Yeah, it is, and it is a little bit more common in men to have kidney stones. For various reasons, but yeah, the pain is quite intense when it's there, and if they can prevent it, it's best.
Okay, and last thing is certain foods. Are there certain foods that are higher in, I think it was oxalate as I was reading this, reading up on this topic, than others that should be avoided?
Sure, so yes, you're right. Tea and coffee will tend to bring that oxalate crystal up. Your calcium will come with eating a lot of foods that include calcium, your dairy and so on. And then the uric acid comes from meat and meat products, especially for those with gout. You know, gout is very painful, and you may have frequent joint attacks, but that's nothing compared to a kidney stone. So avoiding meat and meat products in those people with gout is very, very important.
All right, sounds good. So definitely a person with a family or personal history, they can likely get them again as well?
Yes, they're usually recurrent, and once a person's past that, then they become aware of them, and hopefully will take measures to avoid them in the future.
All right, so the best step is prevention, and again, that is by drinking plenty of liquid. Of course, water is the best. It is time to take a quick break, but Doc is going to take our viewer questions when Healthy Living returns.